everybody is okay, then we will go ahead and start the meeting. So welcome to the Far East Area Commission Zoom meeting for the month of October. We will go ahead and say the Pledge of Allegiance, do a roll call, and work through approving 2 sets of meeting minutes, and then we'll get right on to our speakers for the evening. So Keith, would you like to start us off?
I will. Allegiance to the flag of the United States of
America, and to
the
the republic
which stands one nation under God,
liberty and justice for all.
Okay. Jean.
Roll call.
Yeah.
Roll call vote for attendance. When I call your name, commissioners, please respond with a yes. Commissioner Chamberlain.
Yes.
And Commissioner Monahan is excused. Commissioner Johnson.
Yes.
Commissioner Marshall.
Yes.
Yours truly, yes. And Commissioner Jones Harris is not here. Commissioner Holmes. I know he's here.
Muted.
Unmute, Daryl.
Yeah.
Okay, there you go. You're here. And Commissioner Dotley.
Yes.
Thank you.
Okay, we have 2 sets of meeting minutes to approve. Did everybody receive the minutes?
Yes.
Yeah.
Okay, let's do August 11th first. So are there any revisions for August 11th? No revisions for August 11th?
Move they be approved.
Okay. I make a motion to approve the August 11th special virtual meeting minutes. Can I have a second? Susan?
Okay, I have Chamberlain with the motion and I have Johnson second. Okay, roll call vote on the August minutes for approval. Yes is approval, is approving, no is disapproved. Commissioner Chamberlain?
Yes.
Commissioner Johnson?
Yes.
Commissioner Marshall?
Yes.
Yours truly, yes. Commissioner Holmes?
Yes.
And Commissioner Dotley?
Yes.
Motion approved.
Okay, any corrections for the September 1st meeting last month? If there's no changes to it, I make a motion to accept the September 1st
And I second.
regular meeting. Okay, Tyree second.
Okay, roll call to approve the motion. Yes is approved, no is disapproved. Commissioner Chamberlain?
Yes.
Commissioner Johnson?
Yes.
Commissioner Marshall?
Yes.
Yours truly, yes. Commissioner Holmes?
Yes.
And Commissioner Dotley?
Yes.
Motion approved.
All right. Larry, can we just make 100% sure? I'm trying to think here who's all on the screen. I don't see anyone extra on the screen that would be here for the graphics application of JC 20-030 6472 East Broad Street.
Basically, as I look at the screen, Catherine Carr Harris.
She is one of the speakers for
Speakers, as well as Helena.
That's another speaker.
Helena?
So at
Yes.
this point, unless Quay Barnes has her 2 cents to put in, or Karen says something. Why? No, there's no one here for the graphics.
Okay, I just wanted to make 100% sure before we
Right.
go forward then. It looks like it was withdrawn, but I just wanted to make sure. Okay, so our first speaker tonight will be with ADAMH. And is Jill Frost here at all, or is it just Catherine? Okay, you have the floor.
I understand you might have a PowerPoint for me to use.
Do you I have it, but I was able to change screen sharing over to participants, so.
Don't have it pulled up.
Okay, well then give me 1 second here. Okay. Okay, now I have it up. I just need to figure out how to screen share, share screen. Okay. Hold on. Is it working?
Yep.
Yes.
Okay, so let me close the other things here. Okay. I will let you lead me through this.
Okay. Very good. Thank you so much, Commissioner Chamberlain, and other commissioners and members. My name is Catherine Carr-Harris, and I am the Vice President of Clinical Services for the Alcohol, Drug, and Mental Health Board of Franklin County. I appreciate this opportunity to be with you tonight. Addiction and drug treatment in this county and mental health services is very near and dear to my heart. Obviously, I'm here to talk about issue 24, which is an ADAMH levy that is on the ballot. But let's start with the next slide. I want to tell you a little bit about what we do. So ADAMH funds 23 provider organizations in Franklin County. They all provide mental health and addiction services to a vulnerable population. You all most likely are familiar with many of the organizations that we fund. NAMI of Franklin County is one of our organizations. Excuse me. NetCare is another. Mary Haven with the Addiction Stabilization Center, North Community Counseling. We have many providers all across the county that provide treatment, addiction, prevention, and housing services, again, to the most vulnerable population in our community. So if we go on to the next slide. ADAMH is here to improve the well-being of the community by reducing the incidence of mental health and eliminating abuse of alcohol and other drugs. So we do that by helping residents find the right place for affordable and quality care, whether that be alcohol or substance use disorder treatment, mental health services. Again, we can only do that through our partner agencies. There's 33 individuals, and we're a firm believer in addressing substance use and substance abuse and mental health problems early on. And in doing so, we fund prevention and early intervention services in all 16 Franklin County public school districts. So every suburban district as well as Columbus City Schools. We're committed to addressing inequities and behavioral health disparities that result from systemic issues of poverty and racism. On the next slide. We provide services to anyone that needs them, regardless of their ability to pay. Specifically, for those that don't have insurance or Medicaid coverage, we provide housing and prevention services, recovery support services, and services to families who support loved ones with a mental illness or addiction. Approximately 85% of the people we serve live below the federal poverty level. In 2019, ADAM and its partner agencies served more than 135,000 individuals. Next slide. So, ADAM is projecting a $14 million operating deficit due to the rising need for mental health services and the current opioid addiction. I'm sure everyone on this call knows someone, has someone in their family, knows a neighbor, friend that has been impacted by the opioid epidemic crisis. Suicide deaths in Ohio have increased by 45% over the last decade. ADAM needs additional funds to address growing mental health issues among young people who need mental treatment and prevention services. In addition, the population of Franklin County is projected to grow by 8% over the next 10 years, a potential for more than 100,000 new residents. On the next slide. So more than 71% of ADAMH's resources come from our current 2.2 mil levy property tax levy that expires in December of 2021. The levy millage for ADAM has not been increased in nearly 30 years, while the number of people seeking our services has grown dramatically. It's risen 72% since 2014. ADAMH needs additional funds to address the increasing opioid crisis, devastating suicide rates affecting Franklin County. Dollars invested now will save our community later. The Human Service Levy Committee recommended, and the Franklin County Board of Commissioners has approved, placing a 5-year, $2.2 mil renewal levy with a $0.65 mil increase to support ADAMH on the November 3rd ballot, with collections beginning in 2022. The community is encouraged to support Issue 22, the ADAMH levy. If passed, homeowners would pay an additional $1.90 per month or $22.75 more per year per $100,000 in home property value for the continued vital services of ADAMH. Next slide. So in addition to supporting our levy at the ballot, please go to adamhlevy.com. You can receive updates there if you're interested in yard signs or volunteering for the organization. If you will go to that website, you can sign up to get updated on the progress of our levy and the work that we're doing. And finally, the last slide. ADAMH is working. It is helping thousands in the community address addiction, mental health, and domestic violence issues. And now, with the challenges poised by the COVID virus and the opioid crisis and the devastating suicide rates, ADAMH needs additional funding to keep up with the current demand for services. ADAM is needed more than ever to provide a safety net for our community so desperately needed. So, again, vote for issue 24. We appreciate your support, and I would be happy to answer any question that anyone has.
I got a quick question.
Yep.
It's in regards to the police and their CIT, Crisis Intervention Team.
Yes.
Does ADAMH have any type of finger out there, whatever else, where professionals can respond for these crisis situations with the police to assist the police?
So Are you asking if we support police in responding to crisis?
Do you have professionals that can accompany, that
Yeah.
can actually respond and go to a crisis scene?
Yes. So, excuse me, in the last couple of years, we have worked closely with both Columbus City Police and the Franklin County Sheriff's Office to create mobile crisis response teams. So there is a dedicated law enforcement individual who is accompanied by a clinician. They go out on mental health runs and have a very high rate of success in resolving that without the individual either going to net care, going to jail. They are really able to resolve that. Now, we have, I believe, and I can follow up with this, I believe we have either 10 or 12 teams across both the Sheriff's Department and Columbus City Police. So while it's a start, we desperately need more. You know, we work hard to train law enforcement with CIT, but that's only a part of the equation. You ask a very good question. Having professionals that can accompany police often help de-escalate the situation and make it easier for the individual in crisis to talk with law enforcement, to talk with the professional, et cetera.
Yeah, because you would think that when a 911 call comes in and says we have an individual that has in the past issues, mental issues, drug issues, or whatever else, and at this point we need assistance. At that point, it's not just a question of calling the police.
Yes.
Because that's going to be the individual is going to be the arm of the force itself, but the professionals to come in to do the negotiations with the individual, the assistance for the individuals. It keeps going back to my mind that if that one department had in March a professional team to respond when they had an individual with no clothes sitting in the middle of the street on PCP or whatever he was on, at that point, if they had a professional there, maybe that whole situation could have been averted.
Yes.
Yeah.
Yes.
Catherine, a couple of questions. First of all, what's the level? Well, let me just ask it this way. How are you going to see your budget impacted by police requesting more help from you as a county agency? And how do the chaplains of the city of Columbus, for example, fit into your process?
So that's a very good question. We have just recently had another request from Columbus City Police to expand our mobile crisis response. It is my understanding that there are a number of different proposals that the city is entertaining around the best way to move forward with policing and community involvement. Today, I don't know exactly the direction they're going in. I do know that we will continue to support mobile crisis response. We are in the process of developing a new crisis center, and with that includes looking at a crisis call number, a crisis call center, as well as expansion of our mobile teams. So I don't know exactly what that's going to look like going forward. But I don't think any of us do, but I can say we have had a long-standing relationship with Columbus Police Department, the CIT program, and most recently the mobile response team, and we will continue to engage with them. And then more recently with the Sheriff's Department and the work that they're doing really to educate their officers and deputies and this is really challenging the police to think differently about how they respond to people with mental illness. And in terms of your second question related to the chaplains, it's a great question. I have no idea. We've not engaged that group of individuals with Columbus Police. Now, we have a very strong faith-based initiative. But I don't know specifically that they have worked with the chaplains within law enforcement. but that's a question I can follow up on.
Just a piece of advice, and I'll shut up. As a former chaplain for Fayette County Sheriff's Office, did it for several years. I know that the city of Columbus has at least 8 chaplains, at least 8, if not more, that they brought on board in the selection process. And so all I'm saying to you is, I don't know how that's going to impact your budget, but I do know that just because they're a chaplain doesn't mean they know what they're doing.
Okay.
And so that they need to train, just for what it's worth.
That's very helpful. I had no idea, quite frankly, that the police department had chaplains. So I will follow up on that and really explore. I mean, we've been very open to allowing others to go through the CIT program. So it is geared for law enforcement. And we've opened it up to any police department in Franklin County. We've included university police, airport police, but we've also included fire and EMS workers as well. I think this idea of chaplains from law enforcement is something that I'm going to take back to my colleague who leads our faith-based initiative, and we will consider how we can collaborate with that group of individuals.
And I don't know who it is, but I know that Franklin County has at least, Sheriff's Office has at least 1 chaplain.
So Columbus Police has 8 and
I don't quote me on the number, but I know they have more than 1 or 2.
Okay. All right. Thank you.
Yep.
Does anyone else have other questions? These are great questions. Thank you.
Well, I have one. Where are you located at within our district, our area?
So within your specific area,
Yes.
the ADAMH board itself is located at 447 East Broad Street. And then we have providers that have offices all over the community. So in your specific zip codes, I will have to check and get back to you. I'm not even sure that I know the specific zip codes. But again, we have providers, while they may not have an office there, we have providers in all of the school districts. And then we have providers on Alum Creek, providers downtown, providers in Grove City. I'm trying to think on the east side. St. Vincent's Family Center is over there. Alum Creek is over there. I'm not sure that's in your specific area, but I will. That's a question I'll follow up, and I'll ask Jill Frost if we can get back to you with the specific providers that are in your area.
So as far as you know, you don't know any providers within the Far East Area Commission geographical area, right?
Can you give me the boundaries of your area commission?
So
Hannah,
okay.
down Blackfoot Creek to Livingston Avenue. Or actually Refugee Road, I'm sorry.
So
Yes,
we're in
right.
between
It might-
Whitehall and Reynoldsburg.
It might be a good idea if we could just send her a map,
I agree.
email her a map, and let Lynn be the contact person for her. And then Lynn can get all of us the information.
That would be great. I know North Community Counseling has some services located in Reynoldsburg. I'm running through the 33 providers. I apologize. If you will get me a map, if you can get that to me or Jill Frost, we will most definitely follow up with the providers that are there. I know in the Gahanna School District, Concord Counseling provides service in that district. I don't recall Reynoldsburg, but each of the school districts has a provider that comes into that district to provide services in collaboration with the district. So that's just one area. Our services are spread across the county. Certainly all of our providers take individuals from any part of our county. And our dollars just fund services for Franklin County residents.
Okay, Catherine, I put the information in the chat room I have Jill's information, so I put it in the chat room if any commissioners have any additional questions or any of our other speakers or guests. So it's in the chat room. It's jillkfrost@gmail.com, or her telephone number is 614-585-9433 for those who are calling in. I think.
Is that
And I'll go ahead and send the map to her, since I have her email address, if that's okay, tomorrow.
That's great, and I will follow up with her, and then we will get back to Lynn with some information that you can share with your members.
Great, thank you very much. Appreciate you coming tonight.
Thank you so much. We appreciate this opportunity to share our work with you, and we certainly hope you will support us at the ballot. Thank you.
Okay. Let's see. The one speaker that I left off of here, who came on a little bit late, a couple days ago, is CareSource. So I'm not sure who wants to go, how you want to do this. If you tag team both of you guys,
Yes.
you could both unmute and do your thing.
Thank you, Jennifer. Thank you for having us. My name is Helena Ravi, and I also have my colleague Karen Dawson, who will be presenting along with me. So I'm going to go ahead and pull my slideshow on up, and we'll get started here. Okay, are you all able to see my screen?
Yes.
Yes, we are.
Okay, let's see. I just want to.
Good evening, everyone. Thanks for having us today. We really appreciate the opportunity.
Okay, so thank you, Karen. As I stated before, Karen Dawson and myself, we are community marketing representatives for CareSource. So we're just going to explain what we do out in the community and what CareSource is about and how we can support on the east side of Columbus. So CareSource is an organization that's known with being covered with kindness. And we've been in the community and serving our community in Ohio and specifically in Columbus for 31 years. And we do believe that that when you're in the community and you know where your consumers are, we know how to reach them. We go directly, we meet our members out in the community where they are, where they work, pray, and play. So today, Karen and I are just going to talk about who we are, who we serve, and how we go about redefining the agenda. As I stated earlier, we have been in the Ohio community for over 31 years. We started in the Dayton area as the Dayton Area Health Plan. And our organization has started with the simple question being asked, how do we do a better job of delivering health services for our most vulnerable children and families? And our first initial CEO, Pam Morris, she was recruited to the Dayton Area Health and CareSource at that time to help build the strategy. So she was employee number one during 1989. She was a social entrepreneur who worked a lot of magic to create what is now known as the second largest managed care plan in the country. That's designed to manage costs for states and increase quality to their consumers. And we at CareSource, we have approximately 4,300 employees. So what we are is a healthcare plan. It's similar to your health insurance with United, Anthem, Aetna, ARP, but there are some key differences. We are a nonprofit organization. Our consumers are specialized populations in the Medicaid marketplace and Medicare Advantage space. And again, with us being a nonprofit, we're only a handful across the country. And at CareSource, almost 70% of our consumers are children, followed by women who are pregnant moms, people with mental health needs, people with disabilities, and seniors with multiple complex health issues. So what we do and what we possess is a mission-driven culture, innovative consumer-driven benefits, and we also have community-based partnerships. Our mission is to make a lasting difference in our members' lives by improving their health and well-being. Again, we are a leading nonprofit health insurance company that's located within our community. We have a 31-year history of serving low-income populations across multiple states and insurance products. And we serve 2 million members in the following states of Georgia, Indiana, Kentucky, Ohio, and West Virginia. And we do that by offering the programs through Medicaid, Marketplace, Medicare Advantage, and our dual eligible population. So some quick facts about us. We have a comprehensive member-centric health and life services for diverse populations. We're an independent nonprofit with local community-based model. We also possess a member-centric model of care. We help our members navigate through daily life challenges and obstacles. And we have an extensive network of health partners and hospitals throughout our footprint. So who is it that we serve? Our first group that we partner with is our Medicaid population. And if you're not familiar, this is healthcare coverage for eligible Ohioans with low income, pregnant women, infants and children, older adults, and individuals with disabilities. And with the Medicaid population, we are the #1 Medicaid plan in Ohio. We have more members than all other Medicaid plans combined. And we also have over 1.2 million Ohio members. So when individuals look to apply for Ohio Medicaid, they can do so by contacting the Medicaid hotline number at the 1-800-324-8680, or either go online at www.ohiomh.com. And they can be serviced Monday through Friday from 7 a.m. to 8 p.m. and also on Saturdays from 8 a.m. to 5 p.m. And to keep in mind, when a new Medicaid member has 90 days from their date of approval to choose another managed care plan, that's one of the times that they can choose and switch. And then the next time would be during the Ohio Medicaid open enrollment, which is in November next month. And just cause membership termination is also an option to change plans outside of open enrollment periods. On this slide, Karen and I had included just a picture of one of our billboards that we have up. You might see them around Columbus. I know there's some on the west side of Columbus. I've seen some, this particular billboard also in Kentucky when I was driving through that state. But this billboard is just explaining to everyone that we are one. We are with our community, our members, and then also pointing out that we were labeled or received the actual the status of being the #1 selected Ohio Medicaid plan here in the state. So we do have these billboards, so you might see them as you're driving through Columbus. And through our Medicaid plan, we offer the Ohio Medicaid Members Rewards programs through our Babies First, Kids First, and Women's First. And for Babies First, this is for pregnant moms and babies. And our members can earn up to $150 on a gift card that gets loaded for keeping their doctor's appointments. And it's similar with the Kids First program as well. This is for children ages 18 months up to 18 years of age. And on this particular rewards plan, members can earn up to $60 or more in rewards annually per child well visit, vaccines, and dental exams. And then with the Women's First program, this is for women between the ages of 19 to 64. And our members can earn up to $90 or more in rewards for women's health and general health screenings. And this looks at rewards with the following stores such as Walmart, Dollar General, and they can purchase, excuse me, I'm sorry, that's for the babies and kids first, but the women's first, that's with Google Play, iTunes, Panera Bread, TJ Maxx. So that's the difference between the women's first and the babies and kids first. And then our marketplace presence that we have, we offer real health insurance coverage for those who do not have employer insurance and do not qualify for other insurance programs like Medicare or Medicaid. We've had a presence out on the marketplace since 2013. And we have been out there. We've remained consistent with providing insurance options through the Marketplace Affordable Care Act. And we also have 3 different tier levels in which our members can choose from, which they can make a decision based upon their income and also what specific healthcare needs that they might have. We at CareSource, we're committed to the marketplace. We offer competitive premiums through the different plan options. We also conduct updates to our benefit design from our consumer feedback, and we have enhanced network of healthcare providers. And on this particular slide, you can see the counties that are shaded in purple, and that's where we offer the marketplace currently. Our marketplace open enrollment date is November 1st through December 15th. So we're also soon approaching that. And the CareSource Marketplace phone number is 1-800-479-9502. And that's Monday through Friday, 7 a.m. to 7 p.m. And you can also visit our website at caresource.com/marketplace. Our Medicare Advantage presence that we also have is a CareSource Medicare Advantage plans, which provides all of the Medicare benefits for doctors and hospital coverage, which is under Parts A and B, as well as combining with Medicare prescription drug benefits under Part D. So it's providing personal care that members deserve. On this chart here, you can see the differences between what basic Medicare offers and what our CareSource Medicare Advantage offers. So with basic Medicare and our CareSource Medicare Advantage, it both gives the hospital coverage under Part A, as well as the doctor and outpatient services coverage under Part B. But where we are, we have a difference is that our CareSource Medicare Advantage program offers dental coverage, no or low deductibles on doctor and hospital visits, prescription drug coverage under Part D, enhanced hearing and vision benefits, no or low monthly plan premiums, no extra cost to fitness center memberships. There's a limit on out-of-pocket expenses and also fixed co-pays. And if you all aren't aware, the annual election period for Medicare is October 15th through December 7th. And if any of you would like to know information in regards to our Medicare, our CareSource Medicare consumer number, it's 1-844-607-2830. And that's 8 a.m. to 7 p.m. Monday through Friday. And then from October 1st through March 31st. You can also visit caresource.com/Medicare. So with all this being said, how can we help? Karen, I'll let you go ahead and take over now.
Sounds good. Thanks, Lynne. I really appreciate the information that you've given, and I want to open up and see if there's any questions so far. If not, I'll continue on. Great. Well, as Helena said, we are where people live, work, play, and pray. If you kind of keep up with me, Helena, basically we're out in the community, working with our community partners on levels as far as getting information to actually our actual partners, our community partners. And what happens with that is that they're able to talk to our members and give them the information that we need them to have so that they can stay safe and also stay healthy. I work with a number of churches and a number of community partners as well. Different. It can be from a rec center to a church to a food pantry. It doesn't matter. We like to be in the field, working with our community partners and seeing our clients so that we can make sure that they're getting the information that they need to stay healthy and well. If you'll go to the next slide, please. Transforming care. From the very beginning, CareSource has been an innovative force in the landscape of our healthcare. Our business was built upon the willingness to accept the status quo and insisting there was a better way. Helena mentioned our first CEO, Pam Morris, was a social worker, and she knew that there was more to do in the community. She retired 2 years ago, but that same built foundation still lives on in our company. CareSource continues to be the leading healthcare in innovative and direction, and making different changes so that our members, like our reward programs, can take advantage of earning rewards just for staying healthy. And we encourage them to do that. Next slide, please. Redefining the agenda. We firmly believe that healthcare will be the shape of those who innovate and drive value to consumers. The CareSource model is not business as usual. With us being a nonprofit insurance company, we operate a lot different. We bring innovative thinking and services to members, providers, and government organizations through our Care for You and also our life services programs. Next one, please. Care for You. I always look at this as making sure our clients has the best way to manage different things that they're dealing with. If you look at the Care for You model, we focus on members' health and socioeconomic needs, care management, one-on-one attention to support health needs, disease management, assistant managing issues like diabetes, asthma, high blood pressure, or high cholesterol. Programs like tobacco cessation, women's and children's health, pre-pregnancy and pregnancy program, plus support for your young children, behavior health, mental health, and substance abuse, substance use services and resources, and wellness, like our 3 programs that we have for our wellness for pregnant moms and babies, and also our Kids First, and also our Women's First, and health risk assessment, clarity on personal health and wellness, including physical, mental, and social health. Next, please. This is what I'm very proud of. The Job Connect says exactly what we do and what our mission statement is, which is to make a lasting difference in our members' life by improving their health and well-being. The Job Connect program separates us from other managed care plans. It's a program that CareSource has stayed mindful of our members. How about if, say, for instance, someone who hasn't worked or is interested in working and is a CareSource member wants to work, how do they get there? Suppose someone did not finish their high school education and wants a GED, how do they get there? The Job Connect program is one-on-one coaching for up to 24 months. Also, it helps build the network and partnerships for our members and support in finding full-time employment or educational opportunities. As I look at this chart, the 2 things, actually, it all jumps out to me. But what I'm most proud of is that 67%. If you look at that, those are members who have retained employment. But another number is at 11,853, which is a total community referrals. That comes from our community partners that have referred our members to us for the Job Connect program. If you look at 12,000 more members who have contracted or actually interface with our Job Connect program, that's a pretty high number as well. and members who have opted into life services. And we do have employer partners. I think that's a phenomenal number, because if someone wants a job and they're looking at one of the employer partners that we have, it makes it a lot easier. We make a referral, we can do that. We help our members, help them actually meet their goals and their dreams by working with them through our Job Connect program. Next, please. Enrollment periods, we'll do that again. Medicaid is from November the 1st through November the 30th. Marketplace starts November 1st through December the 15th, and Medicare is October the 15th through December the 7th. Next, please. How can we help? I think Helena and I are very passionate about being out in the field, talking to our community partners, making sure they have the information that they can spread to the community that they're in and that they work with, being a voice for them, setting up different types of meetings so that we can educate people so that they can take the advantage of the CareSource actually benefits when they are on CareSource. We like to do, our goal is to make sure that we have enough information out there so our community partners can take advantage of it. We do agency forums. We did one. I think that was in, when was it? August or July, Helena?
I think it was July, end of July, I think. Yeah.
It was very well attended. It was a lot of fun, and the networking still is going on for that agency forum. Brochures. If you have a location that can hold brochures, we can actually get those to you for your clientele to see and pick up. Presentations, we're always open to do presentations, even if you have a group of people that, may not be members, but you have a group of people that you're working with and you want them to understand or learn more about services, we can also do that. What's been happening, since there has been a lot of people who have lost their jobs during the COVID-19, and they're not sure exactly what to do, where to go, or not know how to get started. What we're finding is that some of the people, they hit their bank accounts until that's drained, or they may not do anything, which is not the right thing, because they don't know that there are government-sponsored programs that can help them during this time of their transition, whether they're going to get a job or whether not. But also look at the actual Job Connect program. Another thing is that we may have actually people who have children that are on CareSource, and the parent may not be on CareSource, but they can still take advantage of the Job Connect program. So we make sure that people understand that and how that works. The newsletter, the local resources, I think Helena and I are good about going out and just say, hey, we knock on doors and say, hey, here we are, use us. That's what we're here for. We do not sell anything, we only educate. Helena has a different area than I do, but we kind of cross paths, so that's why we're both here today. And I think we can be a benefit to you if you're looking for the information that will help people get on their way with the COVID crisis and any other time. Is there another slide, Helena?
Yes.
Okay. Here's our information. You're more than welcome to take the information, call us, email us, text us. If you have a question, please, if someone else has a question and you're not sure, we're always open to answer those calls for the community members. As I say that, follow us on social media, we're there. If you have any questions, once again, please reach out to Helena and myself. Does anyone have any questions? We've given you a lot of information.
You have, hold on real quick first. I put Helena's information in the chat room for anybody to get a hold of her, because I did let her know that the other two commissions would be on the meeting tonight. So Quay, if you're looking at all the people on here, Quay Barnes is chair of the Mideast Area Commission. And where are you, Ava? Oh, there you are. Where it says Commissioner Johnson, that's Ava Johnson. She was former chair of the Greater Southeast Area Commission. And she's chair now. Anthony, I'm not sure how to pronounce Anthony's last name.
Rice, Anthony Rice.
Okay. He's the chair, but both of them are on tonight. Wanted to introduce them to you because Helena is probably one of the greatest assets that I have for the Greater East Side Coalition and getting information out to the East Side. So what I do once a month, she does every week. Oh, I'm very lucky. I pick and pull through everything that she sends and find what's available for the East Side, and then put it out in our newsletter that we send out once a month. So she's been a tremendous asset to me, whether or not she knows it.
Thank you.
Sure. But I did put your information down because I'm sure the other two commissions would like to get in touch with you as well.
Yes, absolutely. And Jennifer, Karen and I, we can put our zip code territories in the chat if it might be helpful for you all, because as Karen has stated before, our areas kind of overlap, and I'm in the east portion of Columbus and she's in the southeast portion. So I cover beginning east of High Street in 43215, 43203, 43205, 43209, 43213, 43227, 43068, and 43230. And Karen, did you want to list your
Sure.
Zip codes? Okay.
Sure.
I'll type them.
I'm the South. I do 43206, 43207, 43232. Also Pickerington 43147. I have Canal Winchester 43110. I have Groveport at 43123. Also, I'm in outer counties of Lancaster and also Circleville.
Well, I can't even say how tremendous the information is that we get from you, including all the jobs that are available every week, and all the programs that I had no idea that existed, that pop up every week that's free for the public. So we'll continue to share all that information. And if commissioners have any questions, since we're running low on time, please get a hold of either Karen or Helena, depending upon the zip code. And again, a thank you out to Sharon Ware, because she was the one who hooked me up with Helena's information to begin with. So I have to give
Thank you, Sharon.
a shout out to Sharon for her help with that. But again, if anybody has any questions at this point, can I have them get a hold of you, either of you, to help them? Is that okay, Helena and Karen?
Yes, absolutely.
Okay.
Definitely.
I'd appreciate that. Okay. With that, I'm going to move on to building collaborative connections with Sharon Ware. If you're ready, Sharon.
If I remember to turn my mic on. It's so good to see everyone. Oh my goodness, it's been ages since we've seen each other. And here we're coming up on the holidays, and I'm sure Larry Marshall's getting that grill and oven started, so.
I got to work out with the police for Blue Christmas.
Yep, just call me, me. Again, it's good seeing you all, and thank you, Jennifer, for this time of sharing something that's really dear to my heart. Jennifer and the rest of the GEC committee, Quay and Ava, we've over the past several months have talked about how we can really, reach where everyone feels like they are being heard and being seen. And that is, how do we communicate well? And how can we, especially important for us as community leaders, to be able to listen to our neighbors, to hear them, and providing that opportunity where, again, they recognize they're being seen and heard. It's been, I guess, a couple of months ago, many of you participated in James White's workshop on communication through the Area Commission. And it just followed through with a training that we did at United Way in Leadership Academy using compassionate communication staff members. Tom Carlisi has a program called Nonviolent Communication. And it's a fabulous program. I actually went into it and I thought, this is maybe too, what do I want to say? Too, not hippie, but, 60s, laid back. And I thought for sure, people are just not going to flow into this, even though I saw the principles of it. And I was really amazed at what the program did in getting people to really understand how to ask questions and to ask them mindfully for clarification on sharing and engaging in conversations. So I called Tom and asked him if this was something that he could do virtually and that what it would look like. And so what he shared with me, yes, he does this, in fact, all over the world. The program is based on empathy, sharing authentically without judgment, and seeking mutuality with respect for all. And those three things alone were kind of the things that James White kind of left on the table and walked away with. And I would like to ask you to consider thinking about doing a training with Tom. In fact, he has already gone and solicited funding half of the cost from the Rotary Club. The sessions would be 6 one-hour sessions over 6 weeks. What it does is provide the ability to practice some of those, key words and phrases to use and for inquiry and for moving a conversation along to ensure that each of the two parties are hearing each other. And in fact, there's a game board that goes with it that you can take home upon completion of the task. Again, I just feel very passionate about this. We have spent almost 20 years of most of us knowing each other and always finding new things out about ourselves and how to talk and engage. But let's face it, most of the acquaintances we have in our communities has not built that kind of safety net, that ability to know that to disagree doesn't mean we don't love each other or care about each other, and that it's safe to even ask for further inquiry. So I would welcome any questions that you have.
Okay, Sharon, so I put your information all in the chat room. And so we were, when we first were approached about this, we were thinking that this could be something that possibly the three commissions could all go in together on funding wise. And is there $1,000 that's left after he submitted to the Rotary?
Correct.
program?
Yes. Yes.
So that would be maybe $1,000 that we would split between the 3 commissions if that was something that that we would be interested in pursuing then, and have, you know, whatever commissioners wanted to attend the 6 sessions could go ahead and do that then.
Correct. And they're just so that people are fully engaged, he's putting a limit of 20 people in that, and they would have breakout rooms. So that's what, you know, it's part of that engagement and the learning process would look like.
Okay, Quay or Ava, do you have any questions right now?
The sessions, would they be generally in the evening, afternoon? What do you anticipate, Sharon?
I think we would have first a bit on what you would want. I was just thinking evenings, you know, because you all are already engaged in so much. Generally, this kind of program would go over 12 weeks. And just even for our academy at United Way, I told him, I said, we can't do that long. Can it be designed for a shorter period of time? Each session would only be an hour.
Is there any accreditation that we would be able to, that would be associated, that we could like put forth on our commission pages for going through the training possibly?
You know what? I don't know as such, but he could create one. I mean, really, because I think this is other groups around are looking at that whole form of impactful communication. And I think if it was something that just said what that encompassed and what we walked away with would be helpful. So I'll ask him. And certainly there may be something, especially under the Rotary, since they're going to be part sponsors.
Sharon, is it going to be by Zoom, and can you get it as much out of it as you would if you were in person?
So it will indeed be Zoom. And yes, indeed, you can. It'll be a different perspective. I'm not going to say something. Yeah, but yes. And what makes it that way, having the breakout rooms where you have to interact and practice.
Okay.
Sharon, is there any way to have more people among our commissions? We have probably about, what, 40 or 45 people, so 20 is not a lot of slots. So
no, and I didn't mean, to your point, he was looking at least 5 to 6 people per breakout room, no more than that.
Okay.
And he will have assistants. So I think having more than that. However, if there is an interest, I would be willing to help look for more money if we wanted to do future classes.
Okay, that's good to know. Thank you. One more question. When were you anticipating starting? Because our commission doesn't meet again until the end of October, and I don't have the authority to, even though we would probably have to vote on it, but I could recommend it. But we would love to probably have you speak. When are you thinking about starting this, in November or sooner?
No, he said at this point in time, he'd be looking at January.
Okay, January. Okay, all right. Okay, that's good. Okay, I'll see if we can get you on our agenda for the end of October.
All right, fine.
You already have an in with us, Sharon, you know that, so.
Okay, with that, and you're more than, Commissioner Johnson, if you wanted to maybe request if Sharon wanted to go in front of your commission just to explain it a little bit better too.
Right, that's what I'm saying. We meet at the end of the month, so I know I can't explain it, but we'll invite you out. We send in a request for the agenda, so I'll definitely make a submission on your behalf, and I'll get with you offline just to figure out the date.
Certainly.
Okay.
All
right.
Okay, and then the commissioners who are on the Far East Area Commission, if this is something that you would be interested in, can I make a motion to approve the sum of $334 for the Building Collaborative Connections seminar sessions?
Yeah.
I think it's a good idea. Otherwise, it's money that sort of evaporates. This would go to a good cause. So I'll also.
Can I have a second motion to approve?
Yes, second.
Tyree, second.
Okay, hold on a second. Let me write this down for motion. Chamberlain, second. Okay, who will set the amount of money, Jennifer?
$334.
And 30 cents.
No, we'll bump up from the 330. We'll bump up to the whole number, so that way the other two.
335.
Okay. 335.
You really think you have that much money to do that, do you?
Okay. Okay, we had a motion, which was second, to approve $335 for the virtual training of building collaborative connection. A roll call vote. All who approve, yes. Those who disapprove, no. Commissioner Chamberlain?
Yes.
Commissioner Johnson?
Yes.
Commissioner Marshall?
Yes.
Yours truly, yes. Commissioner Holmes?
Yes.
And Commissioner Donnelly?
Yes.
Motion approved.
There you go. Thank you, Sharon.
You're welcome.
Thank you,
Thank
Sharon.
you. Thank you. Can't wait to see you all. I'll be at that training as well.
Great. The more we see of you, the better off we all are. You know that's true. Okay. Last on the agenda is in regards to the Noise Wall Pine Hills community. So I'm not sure, Susan, if you want to start us off towards this, or Lynn, maybe, do you want to talk a little bit about the kind of, with Arlene Phillips, the whole, like, how this progressed?
So Arlene isn't here right now. I just want to say the city of Columbus was very impressed that Pine Hills was able to pull off getting petitions done during a pandemic. And there was a cutoff time. If it hadn't been done within a few days, they would have not gotten the wall. So this was just amazing what Pine Hills had done, and now the torch is passed to Walnut Hill Park. It's in Susan Johnson's hands. Pine Hills has great information. There is Noel Akala, who is from ODOT, who is there to support you. I'm here to support you. And we can, even though we have some time, I think that it would be good to get started as soon as possible. And at least try to get information. I know that Quay and Sharon you worked on the walls years ago. and got that taken care of. So the torch is passed to you, Susan, and we'll start whenever you say and get a meeting together. Did you have anything to say?
Well, I got an email from, I forget the name of the man that's in charge of that. And I was looking for some additional information. If I understood, they already have, they've heard from 40% of people, and I don't know anything about that. And I don't know which people have already signed. So I needed to have all of that information before I can figure out anything else. We also have bordering the freeway are all apartments. And that itself will be a problem more than the homeowners. But again, that the whole strip are apartments. So I need to know what I can do or what I need to do from that. So I was hoping that Arlene would share tonight. Otherwise, I'll get with you, Lynn.
Okay.
And decide what my plan should be.
And then maybe I'll get her on a Zoom with with Noel, and we'll talk about that. Thank you.
Lynn, do you remember with apartments, didn't we just go to the owner? We didn't have to go to everybody.
Yeah, and that's what they did with Pine Hills.
Yeah, okay.
He can talk.
And that's what we did with Yorkshire.
Okay, with Yorkshire.
I had to go to a lot of the apartments. We had nursing homes. We had some businesses.
Yeah.
And I just went to the owners of the apartments. Everybody signed. Now there were a set of apartments, condos. There were like condos that were rented out, but there was one management company that owned the condos. So I got with that manager, not the individuals, because they really don't have a say-so.
Right.
I got with that manager, and he's the only one who refused. But all the nursing homes, all the other apartments, they went along with it. And when I looked at the petition, I noticed that they were building up to that point where it was refused by the condo owners, and then they picked up at the other portion where others agreed. So you might get some negative out of that. So don't let it bother you. Go move on. Just keep moving on.
And since you've gone through this process also, if you do have time, we might get you on that Zoom also. Thank you.
Thank you.
Okay, I'm gonna go a little bit out of order. Officer Poole, do you have anything that you need to share with us tonight? I don't want to keep you on here too long.
No, that's okay. Well, great. I greatly appreciate you guys inviting me. First of all, just a reminder that tonight is National Night Out. It's just an odd time of year to have National Night Out, but obviously due to COVID, the dates changed, and I want to say there's only maybe one or two events that it's occurring within the city of Columbus today. So I don't believe anybody's doing anything celebrating or having any type of an event on the east side. Is anybody aware of any that occurred today? No.
Just
No.
porch lights.
Yep. So I encourage, if you haven't sent an email out, please send an email out. Just remind everybody to turn the porch light on. Obviously, every one of you guys that's on this Zoom meeting understands how important National Night Out is, especially during this time of what's occurring in this time of the world, especially the city of Columbus. We're seeing a major increase in violent crimes. I just sent an email out that I just received today, and that was the most recent homicides that we've had on and up to date. Let me see here. I just sent it out to the community, so I know that you may have not received it yet, but I just want to give you a little bit of stats, what they're looking at for this year, and then I also want to bring up another incident that's occurring that may not be in the public yet, but it will be soon. Give me 1 second. Let me pull it up on the computer here. Give me a second. I just submitted to the community, and you guys are, at least those that are within my distribution list should have received this. It's through the Major Crimes Bureau, which is the homicide section. As of September, year to date, September the 29th, 2020, and again, that's the 29th, we've had 116 homicides. I know since the 29th, we've had, I want to say 3 or 4 more. I think we're up to 100, I'm sorry, I think we've had 5. I think we're up to 121 or 22 currently at today's date. 123? Okay, thank you,
They
Larry.
have one yesterday on the 6th. Yeah, they have one on the 6th, so it's 123.
123. Thank you, Larry. But the stats is this as of the 29th. And then as of the September 29th of 2019, the year to date, from January 1st to 2019 to September 29th, we had 81. 2018, we had 85. In 2017, we had 100. Unfortunately, the year that we had the most homicides, which included the homicides of Mount Carmel West, the year that included those homicides with the doctor, you guys remember that? Mm-hmm. That unfortunately we will more than likely probably exceed those numbers the way it looks. I hope not. I hope and pray not, just because when we're talking about these numbers, these are not numbers that we want. Absolutely not. So I just want to kind of give you guys insight of it. And if you did not receive this email, please ask Lynn to forward it to you. She was CC'd on this as well. It's an attachment and it's public record. And just to note that zones of homicides that we've had on the zones, zone 1, and again, that's as of the 29th. So not including the 5 or 7, I think that I'm missing. As of the 29th, zone 1 had 14 homicides. Zone 2 have had 31 homicides. Zone 3, 23. Zone 4, 26. And zone 5, 22. So
We're the highest?
We are the highest of zone 2, 31. The second one closest to that is zone 4 with 26.
Wow.
So we've had, and again, as of the 29th, and again, we haven't included the, I think 4, 5, 6, 7, 6, I think, maybe 7 that we've had today. So that's not including those. So I don't know where those were all at. But it appears on zone 2, since you guys are on zone 2, according to the stats here, 9 precinct had 8 homicides, 13 had 7, 14 had 11, and 20 had 5. So 14 precinct had the most homicides on the zone as of, as of the 29th. And I know a couple homicides occurred over on Bryce Road. And if you guys are not aware, that lovely C1 grocery store, convenience store, whatever it's called, thank goodness for our zone investigator, our zone attorney. And Tara, yep. Shout out to her, plus Safe Streets and the detectives that all worked that cases, was able to shut it down. So I know that is a good thing because there was more than just homicides that was occurring there. And typically what happens is, especially when it's a business like that, if it's got the homicides, there's obviously other problems that occurs as well.
Officer Cole, when does Safe Streets close down?
I think they've got, from my understanding, I think they've got at least maybe a week or 2 left. I want to say it's probably I want to say it's the 20th. I'm not for sure, but it's only maybe 2 weeks if that.
We pitched really hard for it at the city council's east side.
Well, they did extend it for 1 month. They did. It was scheduled to close, or to let's say close, to shut down the 1st or 2nd week of September, and they extended until up to the middle and end of October. So I want to say it's the 20th. I'm not for sure, but I know it's in October. So definitely they were able to designate personnel to that business and to those complaints. So I know that they retrieved a lot of guns at that location. That's a lot of proactive policing. And unfortunately, our patrol, just each and every one of you guys know that on zone 2, especially 14 and 20, there's not a lot of proactiveness because all the officers going run after run after run, just reacting with all the dispatch runs. With that being said, I also want to bring up one other thing is if it has not been hit with the media yet, it probably will soon. We're having a pretty major incident that's occurring on the freeways, and these are shootings that's occurring on the freeway. One that was just happened just recently was on 670, where somebody is driving by and shooting at moving cars. I want to say that we've got estimated about 20 plus throughout the whole city, and I'm surprised that the media hasn't caught on to that or hasn't been public yet to a point that everybody knows about it. But I'm seeing the reports coming in. There's only a few incidents where the driver occupant's been struck, but a lot of the vehicles, obviously the vehicles has been struck. And some of the witnesses / victims are claiming that it was another vehicle on the freeway that was shooting at them.
Officer Poole, how do we, I've requested through Tom Smith a map of the locations of the shootings on the freeways. How do we go about pushing for that to see if we could get a map of all those locations?
And if Tom has not sent that out yet, I would, I'll get you guys connection. I'll maybe reach out to our zone commander and see how he can help out with to see where these shootings are at. Commander Ally, I'm sure he would be able to assist out some, but I will get some connections here. And apologize if Tom has not had a chance to respond to that request. And again, all the data may not be available quite yet as far as where every pinpoint is, because a lot of these people are getting home, finding out their car's been struck, and then thinking, okay, where did this occur at? I believe it occurred on the freeway, but where at? What part of the freeway? And where do I need to take a report at? Because sometimes, the victims maybe live out of town too as well. So, now they got to coordinate with us to get a report and those things. But the one that happened on 670, I want to say that I thought that I may have sent that out. Did I send that out as an alert yet, by any chance? Did you guys receive that?
Don't think so. I don't remember that going out.
What is the time frame? Is it usually during the day or at night?
They're all throughout the day and night. There's some in the evening and some during the day. So I don't know I don't think there's any during like midnight to 6. I haven't seen any of those, but I've seen them going from in the morning, late morning, all the way up until the latest one. I think it was 7 or 8 o'clock. So during rush hour traffic. So yeah, it's not. And I think, was there one? I think it was actually, it was on the news. It happened in Hilliard.
Yes.
70. Did you guys hear about that one?
Yes.
Yes. Okay.
It was by a black truck.
Okay. Is that what it was? I don't know the particulars about it, but yeah. It's not about the parade or anything. The one that happened during that parade that went around 270. This is actually, yeah, this is actually an incident that occurred. Maybe it was in Hilliard. Maybe it was in Dublin.
Was that road wage event that happened?
No, not that one. It wasn't that one. No, it wasn't that one. It was another one that went out. Let me see.
Was that with the pastor? The pastor that was shot at? There was a pastor that was shot and he didn't know whether it was a rubber bullet or a real bullet that came through his car.
Was that in Hilliard? Was it in Hilliard or? That was
on 270, around 270, from what I understand.
Do you know what area that was by any chance?
They mentioned Dublin.
Okay. So let me see here real quick. Let's see if I find something on the news. Let's see here.
Wasn't there one on the east side also that happened?
Hilliard investigates shooting. Let's see if this is it. No, that's the one with the Trump's parade. So that's not it. That's the one that the Licking County man was charged. Licking County charged 270 breaking news come in. That's probably going to take Trump over or take president over anything that what led to. No. Okay. All right. So I know there's something that was on the news about a shooting that occurred. And they didn't have any suspects information at all. But I know that the one that happened on 670, let's see here. I thought I sent that out. Maybe I did not yet. I have not.
Hey, Officer Paul.
If it occurs to you, who are you supposed to respond to?
I'm sorry, what's that again?
If this occurs to your car, who do you respond to when you get home?
Well, okay, yep. So you got to call it immediately 645-4545, and
Okay.
And that's the problem is a lot of people don't know who to call. You know, what if I live in Zanesville and I get home in my car and I think, oh, you know, I was on 270 at 70 and I thought I ran over something and now I see bullet holes inside of my car. So that's what's really concerning to me is that it does need to be public out there. It needs to be, I don't know how, again, I just think that the public needs to be aware of what's happening. And I will reach out to see if there's been any accurate data. And again, it's just one of those things that, I'm seeing a few of them on the east side, a few of them on up north, a few of them on, different agencies. And it's being gathered up that there's been over the past several months, estimate at least 20 of them. But then again, are they able to pin to, did this occur on the freeway or did it occur somewhere else? But with the most recent one occurring on 670, and I just cannot find it here. Sorry. Let me see if I go back over it again and see if I can find it.
Yeah, it'd be interesting to see if they have any data that goes with it, if they're shooting at cars or trucks, or if there's anything in particular that they're choosing to anything that would help.
True. Let's see if 670 shooting Columbus, Ohio. See if the one over here. Okay, here we go. Yep, it's in the news. One injured in shooting on 670 East near side Columbus, Ohio. So enter that into the internet and you'll find 18-year-old injured in shooting on 670. Looks like channel 10 aired it, or at least posted it. This occurred on the 5th, which was yesterday. Am I correct? Today the 6th?
Yeah.
Yep. Columbus police say 18-year-old man was hurt in a shooting Monday on 670 East, just west of Leonard Avenue, exit near downtown. According to police, the shooting happened around 6:20 p.m. Victim was driving along 670 at the time. He was shot. Witness told police that he saw a person's arm reach out of a passenger side window of a dark colored SUV with a gun just before the shots were fired. Officials
So that would mean two people then, right?
What's that?
That would mean two people if he was shooting out the passenger side window.
No, he wasn't. He said the witness, which is a witness, told police they saw a person's arm reach out of the passenger side window of a dark colored SUV with a gun just before the shots were fired.
Right, but that would mean somebody's driving and then he's in the passenger seat shooting, right?
Yes, I see what you're saying. Yes.
So that would be like there's an accomplice to it.
Yeah. Oh yeah. I would assume so. I would assume it's just not the driver that's shooting. I'm sure that it's passengers in this vehicle, if that's the case, shooting at moving vehicles. And that's, obviously it's very dangerous in both ways. Because my point is they're not shooting at the vehicle, they're shooting at the person. Their intent is to cause physical harm to the person or persons in the vehicle. But yeah, just look at the website, just enter that. And what I would do, Jennifer, is to maybe send that to Tom and say, hey, here's additional information. What's that?
To prompt him.
Exactly. Yep.
Hey,
Okay.
Officer Paul, real quick.
Okay, go ahead.
Yes, sir.
Is this a trend that's going on in other cities or principalities and you guys heard off of in any?
That I don't know. I don't have the answer for that. I don't.
Okay.
I just know that, you know, it's more than a handful. So my fear is somebody or someone or some people are out there doing this, that somebody's going to get killed. Somebody's going to get run off the road and crash and die. And we need to put a stop to it.
Homicides have been shooting from cars to other cars.
What's that?
A number of the homicides the past 6 months have been where they're shooting from one car into the other car.
You're right. There has been. Yes, there has. And I don't know if there have been on the freeway or not. That I don't know.
No,
And again, the homicides that we've had, I don't know. Now the map that I guess you can look at the data that I provided you, the statistics, to see whether or not majority of them are known suspects. That would indicate whether or not, or help out whether or not the ones on the freeways would be known. I'm thinking that it's not. I'm thinking those are just random, the ones on the freeway.
Officer Poole, I know you're not a lawyer, but when someone shoots at another vehicle, why do they call that just illegal discharge of a weapon as opposed to attempted murder?
That's a good question. I mean, for me wise, I believe that's attempted murder. I do. But unfortunately, you have to have the attempt there at first. Now, if I don't have the answer for that. I would think that the statute, if you caught a suspect that was shooting at a moving vehicle, that you would, to go back, you guys remember the 270 shooter that occurred? I want to say it was probably
about 6 or 7 years ago. I was going to bring that one up. That was
that was actually,
I got hit by that guy.
That was actually longer than that. That was actually when I was a detective.
About 10 or 12 years ago, you think?
Yeah, that was probably
I-270.
Yep, I-270, and they caught the suspect on the south side of 270. And he was up on the bridge shooting at cars.
Right.
Yep, and ultimately a couple people died. I want to say at least one person died. I know one person died. But there was a lot of victims struck, cars ran off the road, stuff. So, but he was ultimately charged with that attempted murder on all those vehicles.
Oh, good.
So to answer your question, yes, I believe that if there's enough, I believe that if there's enough evidence, there would be a charge of that. So yes.
But it didn't happen with the guy in the Trump motorcade.
I don't know yet. I don't know about that.
Was he
case.
killed?
No, he wasn't killed, but they just charged him with illegal dischargeable weapon.
But did he
supposed to shooting?
Did he? Yeah, but did he strike?
Turned himself in too, and he said the truck was the one that prompted him to shoot.
Oh gosh,
a little shaky.
Yeah,
he said the truck tried to hit him.
Yeah, but
I know.
I wonder if part of it might be that to show intent, whether they're trying to shoot at a vehicle or if they're trying to shoot at the person in the vehicle. I wonder if that's what makes the difference in the charge.
But I agree with her though. If you're shooting at a vehicle, your intent is to shoot at the person.
Right. That law needs to change. We got work ahead.
I agree. I agree that anytime you're shooting at a moving vehicle, you're shooting at the person. I mean, but then again, I don't make the law, so. But yeah, hopefully that answered for you what you were looking for. So sorry.
Officer Poole, how can we have more homicides in the Linden area? What zone are they in?
Linden area is on zone 5. I'm sorry. Yeah, zone 5.
What's Hilltop?
Hilltop is zone 3.
And we have more homicides in Hilltop and Linden?
I'm sorry, Linden area, zone 4. Zone 4. Zone 4 is Linden area. So Linden area had, that's 5 precinct. Let me see here. 5 precinct had 13 homicides. So they did have the most homicides. But we're looking at the zone. So you're looking at zone. So zone 4 is, okay, so you're looking at a zone. a zone has
Several precincts.
four precincts.
Or 4.
Okay.
Yeah, 4. Is that right? 9, 13, 14, and 20. 4 precincts. You could have 2 precincts that are so wonderful and so nice and friendly that they only have no homicides, maybe 2 homicides. Okay, but then you have 2 other precincts that are going off the wall. But then if you have 4 precincts like ours that are just about equal in each precinct, that's what adds up. Does that kind of make sense? Because I'm looking at the map here on the precinct, and the precinct clearly states that 5 precincts, which is Linden area, had 13 homicides. And 13 homicides on all precincts, that is the most. But how many precincts are on zone 5? You've got on zone 5, you got 2 precincts, you have 3 precincts, you have 4 precincts, and you have 5 precincts. So 2 precincts had 12 homicides, 3 precincts had 0 homicides, 0.
Okay.
4 precincts had 1 homicide, 5 precincts had 13 homicides. So that
Okay.
equals out to 26. But here we are on on zone 2 that had 8, 7, 11, and 17, or 7. I'm sorry, 5. So we're looking at 31. So that would explain what you're referring to. Yes. So yes, that small area may have violent crimes or may have crimes, but we're looking at ours. You know, it's like this. It's kind of like spreading,
Right.
spreading.
Wealth.
Or not spread. Yeah, spreading the evil or spreading whatever. Instead of having one area, it's spread it out on ours. So that's kind of like what we're looking at on zone 2.
So what is the precinct, like Jennifer said, for the west side?
On the west side, that's zone 3. And again, you're looking at 4 precincts.
Okay.
15 precinct, which is part of 3, is Hilliard area. They have 0 homicides.
Okay.
So you're automatically starting off with 0 on 15. So now you're down to 3 precincts. So now you're down to 10 precinct had 11, 19 had 7, and 8 precinct had 5.
Okay.
And so that adds up to 20.
It's a law of averages. Okay. Gotcha.
Yeah. So, but unfortunately, zone 2, our wealth is spread out on the whole zone.
Mm.
And then up north, which is zone 1, only had 14 homicides. That consists of 1 precinct, which had 5 homicides. You had 18 precinct, which had 3 homicides. And then you had 17 precinct, 1, and you had 6 precinct, 5. You had very low numbers on zone 1. And zone 1 is like 161, everything north, and everything east and west. So you're looking at
Woods, Cleveland Avenue.
So you're looking at all the way over to Upper Arlington. I'm sorry, New Albany, over to Dublin, over to Polaris.
Okay.
Does that make sense? So that's zone 1, and then everything south of 161 over to Linden area is zone 4.
Okay.
And then everything from downtown area, zone 5. And then you're looking at west side is like Franklinton, all the way over to Hilliard, all the way over down to Hilltop, all the way down to Grove City. And then obviously zone 2.
Okay. Thank you. Because what we see on the news is not what we're seeing in the stats. So that's good to know.
Yep, and I just submitted to you. I know you got it, Ava. So you guys got it. And again, if anybody on this meeting here that does not have it, Lynn was attached to it, so she has it.
Thank you, Officer Paul.
Yep. So sorry for taking up the time, but I appreciate it. And again, if there's anything else, I'm not criticizing anybody in the city, anybody at all with the reason behind the increase. I just know that I just want to keep you guys safe, especially on my zone. Keep you guys informed, keep you guys aware of things, because you guys really mean a lot to me, and I greatly appreciate all the work that you guys are doing.
Hey, thank you, and tell everybody else we said thanks too.
Yep.
All right. Let's. Do we have Commissioner Marshall? We don't have any kind of a zoning update. We just have one zoning so far for next month.
One zoning for next month. I'd like to have about a minute and a half to recap on a couple of things.
Sure. Minute and a half is yours.
All right. Hines Road is open.
Yes.
Okay.
Good news. It looks great.
Yeah, it didn't really fix the problem, but they need to move the roadbed over by 4 feet, but they won't do that. Okay. Consumer Square, you got more of the excess roads being finished going into Consumer Square. So we're saying thing. I haven't seen any demo permit on sheets yet. And then the last thing is this. Not what I have on my flash drive, but here is my file, including a petition of over 400 names against Green Earth that I am going to give to you, Jennifer, and Brandon, whoever, if they want to learn, zoning. Here it is. Okay, that's it.
Okay, I don't want to bring up too much on Green Earth tonight because Jim's father passed away 2 days ago. So
Who did, Jim's?
Yeah.
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 And I sent him our sympathies. And so sheets you will probably on in that email, they probably won't start anything until 2021. So probably towards the end here of 2020, you should probably receive a demo permit or.
Yeah. Well, the guys that are cooking barbecue out there have fantastic barbecue.
Yeah, I've heard. Yeah, they probably won't be there too much longer.
I told them, cook it quick because those buildings are going to be torn down.
Yep. Okay, so.
Madam Chair, may I ask, where's the sheets going? Because we have one going on South Hamilton Road. Where's your sheets going?
Tussing Bryce Road, where.
Oh, right at the corner.
And the Chinese restaurant was there. Those two buildings are being torn down. That's all going to be one sheets.
Oh my goodness. Okay, so where the Payless store is?
Yes.
Yep.
Okay, wonderful.
And then they'll be approaching us the middle of next year with another location on East Broad Street somewhere.
Okay, excellent, excellent. Well, they're definitely coming into our area. One's going on South Hamilton Road in the Groveport area. So, okay, very
guys
good.
are cooking barbecue there. So, oh, Sheets is coming in. They got a good place.
Yeah, they do. A lot of road traffic.
Yep. Yeah. All right. So, Commissioner Holmes, we don't have any news on treasurer or anything, nothing outstanding. You unmute.
The only cost we have would be what you were doing. So we have, okay, all the money is back into the account. So we haven't made any expenditures at all. Okay. So all we need to know, all we have is the expense you had.
Yeah, well, I haven't received a receipt. I still haven't received a check from Blue Source.
It's all in. We've zeroed out. They did it to the bank account.
Oh, they did?
Yes. We're at $3,800. We're at $3,800 now.
Lynn, that's good news. So they put it, they told me they were sending a check, and I've been looking in the mail every single day for a check.
They put it into the account.
Okay, so then I could get with you to cut me a check for the book bags at Walmart that we bought.
Yep.
Okay, cool. I'll do that later.
So for my record, $3,800 in the account, Daryl?
Yep.
Okay, thank you.
And then while we have you on, Commissioner Holmes, quick update for the bylaw review. We're gonna meet one more time as the committee. Is that correct? Just
Next
to
Tuesday. Yes.
make sure and go through everything one more time?
Yep, yep.
Okay.
And then what we'll do is send the whole commission a revised bylaw so they can look at it and be ready to vote on at the next meeting. So it will show by underline what's being taken out, what's being added. So there'll be no question.
Great.
Okay, do we have a meeting date, or is Daryl going to
Tuesday,
email
next
us?
Tuesday, Gene.
Next Tuesday, thank you.
We haven't set the exact time, but next Tuesday evening.
And I'll go ahead and I'll run that through the whatever that form's called, Lynn, and then
The public notice, city's
public notice. Yeah. I'll go ahead and I'll submit that tomorrow then, and copy you on the email then. Okay.
It's great.
Okay.
Next Tuesday, I have October the 13th.
Is
That's good.
6:30 okay?
Yeah, let's just do 6:30.
Okay.
6:30, okay.
If that's the third is that the third or second? That's the second Tuesday, right?
Yes.
Second
Yes.
Tuesday, 13th.
You
That's
okay,
why
Lynn?
we did it the second Tuesday, so we wouldn't interfere with either the MAC or the GSEAC.
Great.
6:30, correct?
Yes.
Yes.
Thank you.
Okay. And then I'll send out notice for that. Okay, so the last thing that I have really quick is election. And this goes under new business under committees with Susan, who's been checking into the elections. So I've been on the phone today with Lynn and David Huey, trying to figure this out. So if there is a chance, pretty good chance that the governor extends the deadline for us meeting virtually and it goes past December, then our typical elections are held in person. So we need to think about that a little bit. But to preempt that, in the history of our 7.5 years, almost 8 years now, we've never had more people run for a seat than there are open seats. And with that, David said, then there would be, we wouldn't have a need for voting for those seats if they're, in a sense, uncontested. So I put on, with Summer being absent and at the Save a Warrior program, I've been maintaining the website, and I posted on the website today that if anyone is interested in being a commissioner or running for a commission seat, I have a form on there for them to fill out electronically. And that keeps it all records, since it's done electronically. It'll be submitted into us as a commission. And I asked for that by November 1st, right before our next meeting. So if somebody's interested, they will submit their name, telephone number, email address, and a bio slash, you know, why am I running? If we do get those in, then we'll look to see how many that we get in by November 1st. And at this point, we have 3 open seats right now that are vacant. And then Frankie is the only seat that is up for re-election that's filled. So we would have 4 seats that would be up for election / re-election. So I will keep everybody notified as to, you know, if we get candidates who want to run for seats. And then I thought that in November we could talk about if we have more than seats, then we could move forward with, okay, how do we do a virtual election? But until we see if there's more people than seats, I say we could just hold still up to that point, if that's okay with everybody.
Sure.
Yes.
Sound like a good game plan?
Yep.
Yes.
Okay. And then if that's the case, Susan, in November, we would get with you to figure out, since you're the election committee, figure out how to get a couple more people on the election committee to help with that and to facilitate the elections if we do end up with a number of candidates then. Mute. Can you unmute, Susan? Oh, there you go.
In November, then I'm going to wait to see whether or not there are people that have applied.
Yeah, let's just see, because otherwise there's no sense in voting if the seats aren't even contested.
So I don't need to present anything to you in November.
No, not at this point, no.
Okay. Got it.
And with that, Lynn, do you have any community updates? Website?
Oh, yeah, thank you. The city of Columbus listened to the meetings of the commissioners 2 years ago, and they've decided to have websites for all the commissions. This being a website for the Far East, even though you do have one, the Department of Neighborhoods wants you to still have a city website and wants you to put your link for your own website on that website. They are also asking that you update the city website along with your link to your website, and they're asking for one person or to be designated to manage that website, and they will be having a training for about an hour and a half with that designee. And they're asking all commissions to have that same training with a designee selected. So if there's anyone from the commission that, and we did talk, Jennifer, about this, about a designee that you were suggesting, and we'll go forth with that. Are there any questions?
What's the deadline on that, Lynn?
Yes.
What's the deadline?
What?
When do they want to have this done?
They would like to do it in October. So we don't have any date yet, but they do need a designee per commission, and for you to have the links put in the city's website like you will put in your own.
Lynn, are you, if I understand you correctly, the city has no deadline on when they're going to set up the website, but they would like to have a designee by the end of October. Is that correct?
Well, they haven't given me a date. They're talking about October. So once they get those designees, I think they'll come up with a date for the training.
So you're saying that as the commissions become aware that the city is going to sponsor a city website for each commission, are we now to be sending in a designee or wait until later?
I would get your designee identified, and then the city, and I will give that to the city, and then they will come up with a date where that training will be. It'll be virtual, but when that will be.
Oh, okay, okay. That
and I have that in writing, and I can send you what I have in writing.
Okay, wonderful. Yes, wonderful. Thank you. Thank you very much.
And just so everyone's aware, I've been trying to figure out over the last month or two the website, and I think I've gotten the hang of it for the most part. I elected Summer. I don't know how you say that. Like when somebody's not here, you elect them. Is that posthumously?
Girl, you just elected her, so.
I can't hear you, Larry, but.
I think posthumously is dead.
You
Oh, okay, well, she's not dead, but she's not here. But since she does our website the majority of the time, I elected her, but
In
I'm not sure.
absentia. You elected
Yeah.
her in absentia.
There you
Yeah,
go.
there, thank you. But I also elected me secondarily since I've been helping her with the website. So David said it wasn't a problem if both of us kind of did it, went through the training, just so that way I could help her with it. And I don't want to take
redundancy.
Well, not redundancy, but sometimes, you know, things just kind of pile up, and
One, you got that second system.
the website's her baby. I don't want to take that from her. But
It's always good to have a backup.
Yeah.
Have someone to back up.
Yeah.
We can do whatever we want to on our website, but the city may not let that happen.
Well, that's true. I'm sure that's the case. I'm sure that's the case. But at least we'll have a second person who has knowledge of it, just to kind of help her out sometimes too. So I think we're good there. And then was there anything else, Lynn?
And I've given you already half of everything, but just want to say finally that there are going to be some zoning code changes, and the city's just starting with that, Kevin Wheeler, and I will be letting you know as that unfolds.
Oh, joy.
Okay. Lynn, is there going to be any upcoming meeting? You know how we just had one with all of city council? Is there going to be one coming up for the east side with all the directors?
Well,
we usually have one every single year with all the directors.
City council had one on the east side. Are you saying I could check on that?
But I mean, like the directors, like
with the administration.
Yeah.
Are you saying that this was going on in the other parts of the city also, or
no? But I'm saying that every single year they would come out. You know, the directors would do a thing over at the Barnett Center, and the city council would do something over at the Barnett Center. You know, where we went around.
Yeah.
You know, and so I figured what we just had with city council was theirs, and we went into the breakout rooms. But do you know if the directors are going to do something similar? Because I'm sure we all have issues, or not issues.
Yeah, I know
things that we would like to discuss with the directors, I'm sure too.
Well, I could ask them. I think one of the reasons was due to a new administration that they had, because they had a lot of new directors, that they had meetings in the past 2 years. But I could ask about a meeting with the directors and see what I could bring that to their attention.
I would love to have that for the east side. I'm sure the MAC would too, and the Greater Southeast. Yeah. Even if it doesn't go to all the other sides of town, if it just comes to the east side, we would love that.
I can bring that up.
Okay, thank you.
And just Ultimate Resource Network. Daryl, you're on that committee, or you attend those meetings. That's October 9th, 11 to 12:30.
Yep.
And I know Jennifer, you attend those also. And that's just a reminder. If you don't have that information, I can send that. And that's with
Ashley.
Ashley Lindsay Banky.
Could you copy me on that, what you're saying?
Yeah, I will send that to you.
And also in the newsletter that we put out, the Greater East Coalition just put out, there's a copy, or there's a section in there of all 11 learning education centers that we have on the east side. And most of them are starting or getting ready to up and start. So if you want to share those with the community, those are great. That's a great resource for families right now, especially with the kids in the situation with schools right now and the distant learning.
And that
Absolutely.
Greater East Side newsletter has just a ton of good information. So I can share that even further.
Yeah.
I will do
And
that.
just folks to know that this is really something that has bubbled up from the bottom. It was not governmental. Actually, it's Ashley who did it. She was the one who was pushing it via her father, who owns a Lindsay Honda, to the fact that they are actually using one of their buildings for it. And this whole thing also has bubbled up another way, which most people don't know, in Linden, with a house that's also doing the reset program, partially because of what Ashley was doing here. So anyway.
Yeah, the learning education centers, they're mostly, I think, mostly, if not all, are faith-based. So
They
it's
are.
our churches that have really been really rising to the occasion during this crisis.
Yes. Either church or they're nonprofit faith-based, one or two.
Right.
And there's a lot of other things, but I can email, and I've been emailing you. And did you want to say anything about the care, Jennifer, or
About what? I'm sorry.
Because We Care?
The Because We Care. Yeah. Okay. Oh, sure. Yeah. So the event was great. We had a great turnout. We ended up the money that we gave from the Far East Area Commission, we were able to purchase 100 backpacks, and we filled them with school supplies and gave them out during the 2 hours, and then together with the Greater Southeast and the MAC, who supplied money as well, and had food and toiletries, sanitation supplies. Quay, help me think. What else was that? Was that about it?
That was the gist of it all. Yeah. Mm-hmm.
Yeah, but we took many pictures and posted them in the newsletter. So many kids that came by and were so happy to get backpacks for school. So a big clap on the back for the 3 area commissions, because we really rose to the occasion. And Cece, God love her, just coming a week out of having heart surgery, really was instrumental in putting the whole thing together. But so happy that all 3 of us the commissions could partner again together and help our East Side. We do great things together. Really proud of all of us.
You're here.
And there were reported about 200 people, and the social workers saw about 122. Yeah. Social workers and Celebrate One were very, very happy. So I saw Commissioner Dodley, Commissioner Chamberlain. I don't know if there was anyone else from the Far East, but it was all the commissions were definitely supportive of this. And I saw the list of zip codes, and it covered the complete zone 2.
And CPD helped out as well too. Thank you. Shout out to our was it Safe Streets, or was it the Bike Patrol, or that were out there that whole time?
All of them were there.
Officer Tunstall, even some people from the West Side, and they're taking it to the West Side. They're going to do the same thing. And it was, and not only was it a successful day, but Rex and Parks has decided to add a food pantry at the Far East Community Rec Center, which is really because of this event. They ran out of food at Rex and Parks ran out of food. There were so many people. So you've changed Rex and Park for the Far East. They've added them to the CC's list. So I think that's all.
So thank you. It was money well spent, Far East. So thank you for,
Thank you all.
I forgot about that, Lynn. Thank you. Okay, well, if that's it, anything else from anybody else, I'll get you out of here before 9 o'clock. I promise.
Madam Chair, I'd like to say something real quickly.
Sure.
I'm sorry, this is Ava. Let me put my camera on. But I just want to wish you a happy birthday tomorrow.
Here, here. Yay.
Happy birthday.
Happy birthday.
Thank
She's
you.
so modest and she does so much for everybody. So
Yes, she
happy
does.
birthday to you. Happy birthday to you. Happy birthday,
Birthday,
dear
happy
Chair. Happy
birthday.
birthday to
To
you.
you.
And she's so modest.
Youngin.
Oh,
You guys get to see her blush.
yes.
Wait,
All right.
All right, honey. Now she can't
right.
end the meeting.
thank you. Not quite 50, almost there, but
Who cares?
so happy to have all my friends. Thank you.
Yeah, you're welcome.
Okay, well, we will, with that, I make a motion to adjourn.
Second.
Holmes second?
Yeah.
Okay. Do we want to do, what's it called?
Gene's muted.
Not roll call, the other one?
Yeah, by voice vote.
Voice vote.
He's muted. Gene's muted.
I'm sorry, I keep saying voice vote, voice. I said, didn't they mute? Okay.
Okay, voice vote then.
Voice vote. You want me to go down the roster?
No, voice vote. All in favor?
Yes.
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 Thank you.
Yes.
Okay. Thank you. We're adjourned, everybody.
Oh,
All
wonderful,
right. Good
wonderful.
meeting. Good
Thank
meeting.
you all for so cool.
Thank you. Love you all.
Love y'all. Have a good night.
All right. Good evening.
Good evening.